Thank you for coming to watch Dr. Smith's video today. We encourage you to hit the subscribe button and the alert button. That way you can get notifications when he uploads a new video. Thank you for coming today.
So we hope you take the time to hear and think about, and if you have a book, read in the book about the concept and the topics that we talk about. They have a lasting effect. The intent is not necessarily to treat pain, but to make permanent, long-term correction with your whole family and your friends.
Thank you. Make sure you subscribe and hit the alert button. Have a good day.
Have a good day. To correct deviations from normal motion, balance, and alignment, keep in mind the concept of you can't teach an old dog new tricks. So we can't make the old tissue a lot better. We have to train the new tissue as it grows in the body. So we do it gentle and very frequently, like 1 or 2 or 3 times a day. I recommend if you're truthfully trying to make positive changes that you try not to skip more than 1 day. Because the body does regress. Again, we're trying to replace the new tissue to have better function. Now, let's go back to the very first question that we asked on the other class. If structure determines function, does functional change modify structure?
Yes.
Yes, and that's what we're trying to do. That's what therapy is. We change the function from abnormal to normal, and the structure changes. How do we know that that's true? I know that's true because I used to take x-rays of the person, like a bone picture, before and after, and and see the changes. And part of my goal is to teach the patient so that they could look at their x-rays and see what they needed to do. And then when they did it, we took new x-rays, they could say, oh, I need to do more. Or, oh, I've done really good, whatever the case may be. And not strictly rely on pain or diagnosis. So active do-at-home self-care treatment. You all have this hand up before, but I'd like to do a general review. Why do I do the review? I do the review because it's very frequent that people do them not correctly. So they don't get as good as changes as they could get if they did them correctly. For example, I saw a fellow yesterday from Ricksburg. He has a whole body vibration machine. He's using it pretty faithfully, but he has a rounded thoracic spine. He still has head forward posture. He's been doing the sacral slide semi-faithfully on his couch. And I said, why the couch?
You're supposed to have your arms out, right?
Yeah. He said, well, I forget to do it in bed, so I do it on the couch. He said, well, into that story, we're going to start a new plan for you. I said to his wife, make him get on the floor. He's in his late 80s, but he needs to get his head back because it's affecting the nerves that go into the gut. So we're supplying him with gut support, and he's not opening up the nerves that go to the gut. So I said, you must lay on the floor. So I'm going to recommend, when you can, get on the floor. He asked if it should be carpet or hard floor, and I said, well, it depends on how good you are. You've been a good boy, get on the carpet. Put your arms out, shoulders back, palms up. If you can, let the head touch the floor. And then start slowly, both feet up. You don't bend the knees. You breathe in, slide one leg, hold, then exhale. Pause, put both feet out, breathe in, pause, breathe out, turn both feet in, do the same thing. Now, if one leg flares more than the other, take the one that goes furthest and match it. We've talked about a team of horses with a big horse and a little horse. The big horse has to match the little horse, or we create more problems. Now it's very common that they're not the same. It's very common when you slide one leg, it goes different than the other leg. If that's significant, I recommend you lay on the floor with your feet against a sofa or something, and then slide about that far away, about 2 inches or a little more. So when you slide your feet, they go the same.
Good idea.
I examined a girl the other day, a young lady, and she went a lot with one and only a little bit with the, and she can't tell up here, you know, up at the top. She can't tell, so I had her do that very thing. What are we trying to do? Retrain the tissue to be symmetrical. Now, when February comes and make Valentine's, you fold paper in half and cut it along ten. Both sides are the same. That's the way the body should be. Same on both sides. Almost perfect. Now, so you know when you have your feet up, you do that affects your low back more. Feet out, it affects more here. When the feet are in, it affects more up in the neck and head, in the head. Again, I had a fellow who had quite a bit of cranial misalignment. When he does a sacral slide with his feet in, that helps prepare the head for when they come up to do the occipital release.
Okay.
Are there any questions on the sacral slide?
No.
Can it be done in bed? Yes. The best time to do it in bed is in the morning before you get out. In the evening, it's better on the floor. Why? Because it's a little bit better. How many times do you need to do the 6 motions? You lay 3 times with the right leg, 3 times with the left leg, like it says on the paper. And then you're done.
That's it.
That's it. I checked a lady about 2 weeks ago, and she was in fast, and she did each one of them like 5 or 6 times, and she was complaining of pain. Well, she's doing too much.
So, help me with this. So, you do that 3 times?
You do 1, 2, 3.
Okay.
On this.
Then you go to the other leg first.
Okay.
Left leg first.
Okay.
1, 2, 3. You've done it 6 times. And if you follow the directions, every time you slide, every time you breathe in, you think the words, I'm getting better and better every day and every way. That's the conscious mind trained in the subconscious mind that you're serious. And you're doing actions to create that.
So the next step, you breathe. When you do it this way, you breathe here. And when you do it this way, you breathe here. And when you do it this way, you breathe here. Is that correct?
If you want to go that far, that's exactly right.
It's sure good to train the mind to do all that.
Yeah,
You
that's
go-
a
Because you
You
have
go
to focus.
Here,
You know,
you
it's
go
opposite. You start
goes-
down here.
Okay, so this one is your back,
belly breathe.
the straight up. The out is the
Lower ribs.
lower
You
ribs.
breathe wide.
The in is the upper part.
I've never heard that.
Yeah,
Yeah, well, he just told us.
you have to focus
And-
on doing
And that helps even more.
even more.
So what we're doing, what we should do is sharpen the pencil a little bit.
Yeah.
Get better value out of
Wow.
what you're doing. Thank you for bringing it back
To
up.
make up for not being good maybe the day before.
Let's try breathing the right way.
Keep getting better and better every day.
Now, the thoracic roll, this one is kind of difficult, but it helps to enhance rib motion. So after you have done the sacral slide, you're still on the floor. You slide the feet up. The knees are in the air. You're going to breathe deep. And then when you let the air out, the knees go over. Now, when you let the knees go over, you are rotating the low back. Okay, slightly. You're using the pelvic and the low back as a lever to help rotate the ribs. This is not a low back exercise. The purpose is to move the ribs.
So when I do it not that way. I better read my paper.
Yep.
Go one
Time to
way.
reevaluate.
Yeah. Because I breathe in and go down,
Out,
or put my legs to
knees
the
out.
side.
Out.
Yep, that's right.
And then I exhale as I come up.
No,
That's opposite.
Yeah.
you are, whenever you're raising the knees up,
Okay.
you're bringing air in.
Okay.
And you can do, first time you do deep. The second time you do wide.
Breathe up. Down
No.
legs, okay.
And then the third time you do belly.
Belly. Okay.
3 times. 1, 2, 3. So you're going to breathe 6 times. Now some of you may not feel good about breathing wide. I recommend you stand in front of a
I
mirror.
need to learn to do that.
Let your arms hang to your side. Look straight ahead and breathe wide.
Your arms.
Watch the arms move out.
I need to practice that.
Wow.
Okay? If you do that, then you'll know that when you're doing that, you're actually breathing wide. Now, again, why is that important? Well, I will back step a little bit. Each bony structure, we're talking now about the rib cage as a bony structure, has a certain design with certain motion potential and alignment. The structure determines the function. If the structure is deviated, the function is reduced. So breathing capacity is compromised. When breathing capacity is compromised, you lower the cleansing of the blood. Because when you breathe, you're exhaling toxins that got accumulated in the venous system, the lymphatic system, went to the right heart pumped it into the lungs to dump the poison. If you're not breathing properly, and the blood doesn't get emptied, now you have dirty blood going into the left heart to go out to the body. Breathing correctly is very important for good health. And most people, like I said, most people that I check have reduced functional capacity in the lungs because the ribs are rotated. Like today when I was checking you, I said your one side is slightly restricted, so it helps you work it loose. This would help that. Okay. Now, that's how you do the thoracic roll. One time in each position. Then the next order is to go to the occipital release. The occipital release is one of the most important things you can do. I recommend you do it third, like sacral slide, and then the occipital release, or sacral slide, thoracic roll, then occipital release. On the floor. In the morning, you can do the same thing, same order. Slide, roll, occipital, release. On one of the previous classes that we recorded, you can go back and watch it if you want. We had, Deborah was here, right?
I think Deborah's done it, or I've done it, either.
You've done it too.
Uh-huh.
One time we timed it to see how long.
Mm-hmm.
Was that
Yeah,
you?
that was with me.
How long did it take?
Less than 5 minutes.
Yeah.
Under what?
Less than 5.
Yeah, it was about 3.
Yeah.
They do less than 5.
Mm-hmm.
Now, I can honestly tell you that does you more good than a good meal, because it enhances, upgrades the quality of function in the whole body, top to bottom.
Just these 3?
Yes, those 3.
Okay.
I could tell you multiple stories about people that have had patients that have had family call them and say, I've got a bad headache, or I hurt my back, or I hurt my shoulder. And they say, okay, I'm going to tell you what to do. You can feel free to share what I just taught you, and they expect always improvement, never damage, okay? You'll never hurt anybody if they do that for themselves. Moms can do it. Moms can help small children do this. Mm-hmm. Now, how old do you think a child would need to be to benefit from all of these exercises?
Maybe 3?
2 or 3? Yes, 2 or 3. You can help them. You can help walk them through. Kids like to do what parents do. I have a number of people who will lay down with a teenager and they'll do them together. I have a number of people who have small children, and they will help them do the slide, and then they will do for the child the occipital release. Okay, it's very effective. And now again, if this is kind of a repeat. If the sacrum is not the sacrum is not aligned properly and not moving properly, the function of all this tissue is diminished. Even including the function of the brain. I'll give you a couple of examples. I had one fellow who had a low, the sacral angle, the sacrum was tipped flat, high pubis. When that happens, it changes the desire to live, your vitality. You can become suicidal if that goes negative. Some of you probably have kids or grandkids who slump way down, and they tip the pelvis way back, and the spine goes way back. I've addressed kids who have that pattern, and I confronted them with the question, if you considered suicide, and if they have a negative angle, the answer is always yes. I've had a couple of patients who have committed suicide because they would not get the creativity back. And part of the way you get the creativity back is you lower the pubis and raise the back of the sacrum. Think of standing with your navel forward. That makes it very easy for you. I've never told you that. You want to try it?
Stand up.
Stand up. All of you just stand up.
Navel forward.
Now, when you stand, take about 3 seconds and get neutral. Neutral is when you have more weight on the heels. Now, to raise up your rear end and lower the pubis, if you just think about pushing your navel forward, that happened.
Not pushing out with your belly to get your navel to go forward. You don't want to,
That's
you don't
what I
want to
just
poke
did.
your belly out. You just want to
Think about the
move it
navel.
forward.
Just the navel, not your stomach.
Yes.
the
Oh, wait a minute.
What's the difference?
It's the same. It's same. Drop the pubis down. Push the navel forward. That tips the pelvis. That tips the pelvis this way
Okay.
automatically. That also flattens the stomach
And you wouldn't think so, would you?
No.
naturally. Well, what happens? The muscles that attach on the pubis go up to the ribs. You stretch them. You make them longer. They get longer. They move in. Okay. You have a question?
When it was tilted back. That's what
Yeah.
you see with kids in school on these chairs or Sunday school class.
Bad.
Bad. And they just don't care about anything.
Yeah, that's right.
Just like you said.
It affects the mind
Uh-huh.
directly. Now, also, when we're talking about the pelvis, by divine design, God gave you all a built-in rocking chair. The rocking chair is the design of the bottom of the pelvis. You rock back and forth on those bones right there.
That's what when we're sitting like this, that's what we rock back on.
If you have proper, most people will slide down like this. So they're sitting back here and the butt hurts. If they have short butt from sitting too long, it's because they're like that, not like this. You want the pubis down.
I find myself in church leaning forward.
And that brings the pubis down.
So is it
It's not my
almost,
back, it's
it
just.
feels like I'm arching my back.
You are.
It
and
feels
that's right.
better.
And that's perfectly normal. Again,
That.
if the lumbar curve, the low back, the lumbar curve here, by divine design, should have a 60-degree arc measured from bottom to top, that angle. That provides a cushion. If you,
Is Is this the back? This is the back?
I'll be
This is the
right
front?
back.
Yeah.
One pause.
Like this is probably right.
Is that right? Like this? So, when you're doing that, I can't tell what's, so for me, is it this way?
Yes.
That is so
So
opposite.
like you could fit a pillow or your arm right back there.
Is that opposite?
Yeah, that's the way it should be.
Yeah,
Okay.
I'm,
By divine design, the lumbar curve is like this. This is the front.
oh,
The weight of the body is on the discs. That's what they're designed. Their structure determines their function. Their function is to hold the weight of the body in a flexible cushioning design so that if you're bouncing, this bends like a spring. The design of the joints in the back are this way, front to back. Up here, they're designed to rotate. When you do the thoracic roll, you're trying to get these to rotate up here, the ribs to rotate, because the ribs touch the spine, the transverse process, and the body of the vertebra. The ribs start here and go around like this. Here, around front. And we're trying to keep that movement there. Now, when you look at how big that joint is, that's the sacral leg joint. So when you're doing the sacral slide, that's the whole, you're moving the whole joint. And the pubis, and the fifth lumbar, the whole pelvic girdle. Trying to get it mobile and aligned and balanced, so it's the same on both sides. Any questions about what we talked about so far? Now I'm going to cover one more, and that's a microcranial mobilization. If you take your thumbs, go off the edge of the eyebrows, back about 1 inch, 1 1/4, you'll find right there is a low spot. Now you look like a reindeer.
We all be reindeers today.
So where your thumb is in what I call a valley. It feels like a valley. It's a low spot. And right in that low spot, you have 4 bones that come together. If you push firmly and it's tender, one of the bones or 2 of the bones is not moving like it should. It's stuck. So the therapy is this way. You slide the bone, not the skin, forward toward the eye and breathe in. And blow out.
And let go.
Then you slide toward the back of the head, again on the bone. Then we go, number 3, we're going to go straight up. The last one, straight down. And you're done. Now, if those hurt in any way, they need to be moved. Sometimes one side will hurt a lot, only in 1 or 2 directions. That's what it needed. But I recommend when you do that, you do all 4 directions.
Okay.
And you always,
At least one time through.
Just once.
one time.
Just once.
If you're only going to do it once a week, then you're wasting your time.
Mhm.
It's better to do it 4 or 5 times a week.
Good.
I do it when I do these.
Yeah.
What if you had a whole body vibration? Could you do the microcranial?
Can you do the whole body, that on the whole body vibration? The answer is yes.
Hmm.
You can do it then.
And this,
You can do that also then.
and this, and this.
And you can do the nasal spread also.
Mhm.
Now, let's do the nasal spread. We have time. Turn the sheet over. Listen for any kind of frontal face deviation with the fixation. So you put your thumbs against the top of the nose, right underneath the eye. Grab hold of the back of your head with the fingers. The motion is up and out, and you breathe in again. 3 times. Up and out.
How far out do you go?
Okay, when you do that particular exercise, it's not about the skin.
Okay.
Again, it's
Yes.
it's all about the bone. So how
Just
far
the
out?
bone. Okay.
You need to go higher, higher. Get right up on the top of the. Feel that low spot in there? There's
I was doing it clear down here, and I thought, well, I need to move up.
God designed your head with the place for your thumb. Your thumb goes right there.
Oh,
It's not a massage.
No,
It's a bone mobilization.
Under the bone? Or on it?
You're on the bone.
Oh.
You're separating the nasal and freeing up the bone that's behind that. Okay? People have any kind of sinus problem, that's a very good thing to do. I'll tell you a quick story. I've had a stroke and heart attack. They gave me too much blood center. I got a very bad bloody nose. And they put a balloon in my nose and pumped it out tight and left it there for 2 days. That created a chronic misalignment in my head. Welcome. But we'll be right back there in a few minutes. That created a misalignment in my head because it was bent the inside of my head for 2 full days. That took me more than a year to fix that, doing what I showed you how to do.
wow.
It's as bad as a dentist getting in your mouth. And
So that's,
Yeah, anytime you have dental work, your mouth's been open for more than a half hour, you go home and do all this stuff because they change a lot of things in the head.
yeah.
So today we talked about how to do the active self-care. It's free, it's convenient, it's effective. It's very effective. I talked to a fellow today. He said he told me something that shocked me from his perspective. He said, I don't go to a chiropractor because I know people who go to a chiropractor and then they always need to go back. So I clarified, they don't always need to go back. They always want to go back because it's like brushing your teeth. When you're washing the body, when you've been clean, you want to be clean again. And with most chiropractic, they recreate motion, they create some alignment, but it doesn't stay. When you do this kind of therapy on your own, you will need less and maybe no chiropractic care. I see a chiropractor occasionally, mostly to get his opinion of how I'm doing, besides my own.
Yeah.
That's where I do. And I have a very good massage therapist.
She is very good. I'll vouch for that. The best around.
And she does for me better than any of the chiropractors that I've ever had work on me. She does a lot of really good therapy. And she's been trained by the best.
He's helped me. He's helped me perfect my techniques.
Oh,
Yes.
Are there any final questions?
On these last two, this scapula squeeze.
The scapula squeeze and the foot flutter, those are
Is
very,
that like that, the one that go like this?
it goes like this. And people have head forward portion, the knees are breaking down. We put a book between the knees and have them do the foot flutter.
Now, what's the purpose of the book?
To bend the knee back straight. When you put the book between the knees and
It
put the
puts it
heels
back.
together.
Okay.
My legs are straight, so it doesn't show. But if not, my knee buckled in and it went out. Because
So you put your heels together and put the book in there.
Put your
Yes.
there.
and do the foot flutter. And the scapula squeeze, that's above and beyond for people who have a hard time getting their shoulders back. You just
Yeah.
stand in front of a doorway and stretch them back. You're on the T-zone, stretch them back. Stretch high, medium, and low, because you have
All three.
three sets of muscles back to hold the scapula back.
Probably do that breathing too.
You want
Yeah, the
to
same.
open this up, okay?
Listen, I just have the problem right there.
Yeah.
Big time. Still.
If it's sore, you have a problem. You want to open it up. Thank you for coming today.